Do you consider yourself a high achiever? Smart, driven, highly successful? I am so excited to have you. My name is Julia Arndt and I'm the host of the Stress Podcast. I will help you develop your stress resilience the same way you've developed your workplace superpowers. Learn peak performance tools to thrive at work and in your personal life. Let's get started. Hello, peak performers. Welcome back to the Stress Podcast. I'm super excited to be here today with Simon Maltais. Did I pronounce that correctly?
Yeah, it's all good.
Similar. Simon.
Great. Good enough.
How are you today, Simon?
I'm doing good. Thank you. Doing well.
I'm really excited to have a chat with you today about healthcare workers' peak performance and their burnout. And before we get into that, and we've already talked a little bit about it in the introduction before we started to hit the record button, but I'd love to hear from you about where you're located, what time zone you're in, and what you've been up to this morning.
So I'm in California, in Malibu. Just came back yesterday from a 2 weeks work in Montana. I'm just catching up. I came in late yesterday, so made a little food and catching up on all the piles of stuff this morning from the last couple of weeks being out.
Yeah.
Went to the gym, and so that was helpful. But yeah, just catching up on some things, and just happy to be in a nice warmer weather.
Yeah, nice. Where should we start? I would say maybe give us a little introduction about who you are, where you're from, and what you've been up to over the past couple of years.
Yeah. Well, I'm originally from Montreal, so I'm French Canadian. I'm from Quebec in Canada. I did all my training there.
Okay.
I did my med school there. I did a master's in physiology up there as well. Did med school, cardiac surgery, PhD in biomedical engineering, and then left to the United States to do a fellowship at Mayo Clinic in heart transplant and mechanical heart. Went and helped build a program in the South. That's where I learned to speak English. More of a acute need to do that. But I went to Nashville for 5 years to build transplant program, and then moved back to the Mayo Clinic until 2019 or 20, where that was where the pandemic started. Mm-hmm. And then over the last couple of years, I've taken more time for myself. You know, pandemic is also had a significant impact on a lot of things in my life, both personally and professionally. Mm-hmm. And had a interest in mental health in high performing environments, but also in healthcare. And then just decided to write about it. So wrote a book about. I mean, I'd say I'm pretty young, so it's not an autobiography, but it's like based on examples point, I guess, book. Mm-hmm. So decided to write over the last 2 years, so to speak.
Okay. And do you still practice as a cardiac surgeon?
Yep, I actually practice still. I just came back of 2 weeks call schedule. We were doing surgeries every day, so it was busy. But I do have a different, I used to practice quite a bit. The Mayo Clinic was super busy, and I've decided to adjust my schedule to do other things as well. And so I typically work 2 or 3 weeks a month. And then I have about 10 days usually off where I can concentrate on doing other things.
Very cool. How do you love your job?
Well, I still like it. I love it because it's well, at some point, there's this love-hate relationship, I feel, you know. Really love what I do, what I bring to patients. I like the technical. I'm a very technical person, so I like all the technical aspects of it. The particular aspects of doing the heart surgery and preparing for it. The environment in which heart surgery is performed, the culture, the intensity of it is at times difficult. And that's a part that I really had to converged to deal with, because in some ways my personality, or the way I was built, or the way I was trained, was feeding in some of that ability to help people, and it was limiting my ability to help people. And so now I think I'm back into what I like to call a flow state with heart surgery, where I do it well. I know patients by their first name. I know what they do. And I have learned how to appreciate it better. But I love what I do because it brings so much hope and joy to patients, for sure.
Yeah, I mean, it's so fascinating. And how long does a surgery usually on average take?
Typically about 4 or 5 hours
Okay.
from start to finish. I mean, we don't like the surgery itself. Usually the heart is stopped by about an hour and a half, depending on the surgery. And so that's where you work on the heart itself. But from the time patient enters the operating room, patient comes out, usually about 4 or 5 hours. Of course, the more complex the operation is, the longer it takes. The heart transplants can go for 6 to 8 hours. Just the actual operation itself, that's side of the harvest and all the procurement, the heart and things like that. So it depends. On average, I'd say 4 to 5 hours.
Okay. And how do you stay focused? And I feel like, the people that I work with, and a lot of people just sit in front of a computer all day long, and we have constant distractions, right? We are on the phone, or we get a ping, or we chat, or we can just kind of go in and out of our work day. But obviously as a surgeon, that's not possible. So how do you have such a high level of energy for such a prolonged period of time?
It's a very good question. So it's very intense, and so that's one part of it. So you get very focused on one thing. But the way I would describe this, and I've been asked this question before, is when you sort of, and I'm not a pilot, but we've compared heart surgery or high performing jobs like this to driving an airplane or being a pilot, right? So there are times where there's a lot of things are choreographed, meaning from start to finish. Usually we call it deliberate practice. So there's a system to which the operation should go from step 1 to step 2 to point A to point B in a stepwise manner. And then there are those moments where things don't go quite as well, where you sort of have to get back to improvising a little bit more and things like that. So you try to avoid the improvisation and stick on the structure. But during an operation, it's like taking an airplane and driving it to somewhere else, right? You have when you fly out, there's a steady state when you sort of get to a place, and then when you get to the landing, there's high intensity moments. And during heart operation is sort of the same thing. There's a lot of preparation leading to it, opening the patient and preparing some of the things, putting the tubes for the heart lung machine. That is a machine that takes over the heart and the lungs during the surgery. And then there's sort of the landing or the leaving the airport type moment where the heart stopped. And so when the heart stopped, the clock's ticking. And so you do have to perform an operation as effectively as possible. So that's where your concentration level gets real high. And so to answer your question more specifically, there are times where concentration sort of varies, where you can chat a little bit. It's more of a conversation with people you work with, and you can even ask how they did during the day and how was the weekend. And then there's 2 hours or 1 hour and a half when the heart stopped, where everybody knows the intensity of the moment and focus on the operation at task. And then when the heart starts beating again, then there's this sort of oftentimes intensity that kind of comes down, and then the concentration sort of changes a little bit. Not that we're not there, but we know that the sort of landing, and we're just on our way to the runway to the gate, in some ways. And so that's how I would describe it. It's a lot of practice, a lot of structure, and a lot of learning those moments that don't go well, and then learning how to pilot the plane in some ways.
And so how do you prepare for that? I mean, not really for the surgery, but more physically, right? Like, how do you take care of yourself and make sure that in these moments you're like fully present, right? Because obviously it's a super high stress environment. A lot of things can go wrong. You have obviously a patient on the table that could lose their life, his or her life. And so how do you manage all of those emotions, but also like the physical strain of the operation itself? And yeah.
Julia, that's a great question, because that's part of what I've done over the last 2 or 3 years is really work on those aspects of my life that were affecting my work. And so oftentimes you're just thrown into it. The more cases you can do, the more patients you can see, the more sacrifice you can do on your personal life for the greater good, or for the for helping other people. But as I've been doing almost this now for 15 years, and I started to realize that the moments where I was the best, or the times where I was the most concentrated, is when my life was in check outside of work. And so and that means, that's a very general term, but that means sleeping better, that means drinking less, that means taking care of myself and training, that means um, um, practicing gratitude, and some of these things at times you forget how important they are. And then it took me a while to understand that those aspects of my life were contributing in a positive way to my performance in the operating room. And I know it's not sort of rocket science, but you do think like you're a bit of a superhuman, and doctors have usually tendency to sort of think like that way. I was, well, I'm still very, I have a high perfectionism. And so the things that have helped me with perfectionism have also been not helping me so much. And so realizing that some of the good things about perfectionism also not helping you, the self-criticism, the self sort of, that you feel like you never can achieve, a certain goal the right way. And so rebalancing some of the values. So now what I do is I train almost every day. I take usually 5 minutes to write down what I'm grateful for. I manage my schedule. So I have a thing in the book called Virus Scan Myself. So every day I have a moment, usually about noon, or it depends, but usually around midday, where I virus scan how I feel. And so if I feel like I'm too anxious, or like I feel like I'm a bit overwhelmed with all the calls and the phone calls, the new consults, the things, then I just let things go, or I ask for help, or I decrease my schedule. I cancel the case the next day to push it a bit further, so that, and so managing your schedule is a big set of skills that I've had myself to develop to be well-rounded at work. And I know, I mean, it's sort of the similar concept when you're CEO of a company, or you're an athlete trying to manage the performance, and then try to also manage your own life. And if the pie is 90% work, or performance, or sports, or whatever you're trying to accomplish as a CEO, for example, well, there's some aspects of it that will be impacted by your inability to manage some of that stuff. And so I got a coach in the last 2 years that is helping me out. We text on a daily basis, and sometimes I feel like I'm helping him out.
It's a two-way street for sure with coaches. I feel like when you're working with somebody else always, right? Especially when you're getting closer and closer.
Right. So it's been 2 years now, and so we do those things. We do breath work too. That's been interesting to me. My wife is trained as a breath work facilitator, and I got, by osmosis a bit into it. And although I always say I don't want to do it, I feel like every time I do it, it resets things a little bit. And so, to answer your question in like 4 or 5 points, I'd say managing my schedule better, taking time for myself to train, or to do some exercise that makes me happy. And that's not going to the gym and lifting weight for 30 minutes. That's doing something that will make me smile, or have fun, or change, the mood. A coach for me has been essential. I think when you get to these higher performing jobs, having a coach is not a sign of weakness, it's a sign of balance.
Yeah.
Um, and then fostering positive energy around me, whether it's my son, my friends, family. So all these things have been a key to rebalance for me what was going to eventually kill me if I would have changed something.
Mhm. Yeah, and that's the next question that I wanted to ask you, because you said 2 or 3 years ago you had kind of personal and professional challenges. So I assume that it's not always been like that in your life, and that you had to maybe learn the harder way, as a lot of us have to do, right?
Yeah.
To maybe learn that those things are important. Can you tell us a little bit more about, how what happened and how you got to the point where you're at today, where you're like, I know I need to, take care of this, and I need to focus on this and spend time on this, because I know that it will help the larger scheme of everything that you do, both personally and professionally.
Yeah, I think I've had built two major programs. I was vice chair of a department of one of the world's largest cardiac surgery program in the world. I was likely one of the busiest heart surgeons in the United States and in North America, doing 400 or 500 heart surgeries a year. And then I thought I had it all, right? I mean, it's just one more case, one more papers. I had published 160 papers in 10 years of practice. I was on a plane every 2 weeks to go to Japan, to Germany, to whatever grand rounds anyone would invite me into. I think 1 year I actually gave 2 plenary talks about, for research and major meetings. I was the president of this and that. And at some point, it started to chip a little bit, bits by bit. So it was, I think and it was always like, I thought I was driving in the right direction. And then I realized everybody was driving the other way. And I was the one sort of driving the wrong way.
Huh.
But it started with my health a little bit. I didn't sleep very well. I was 50 some pounds heavier. I had knee problems, back problems. And then it started to be more of a psychological things. I mean, I started to be a bit depressed, always negative, very short, not only just at work, but I'd say short, but also angry. Anything would make me angry, like whether it was just because they didn't have any what I wanted at the cafeteria, or somebody was saying black and I wanted white, and and it was personally too. So with my wife and at the time, and then and with my extended family, but also with work. And so it started to be a pretty regular visitor at HR,
Uh-huh.
sort of being a pretty regular person to be called in to the principal's office, say, well, you should be a nice and
Uh-huh.
so, and I thought at the time I was, it was just like, for that, how you have to be, because I'm doing all these surgeries. That's how the life has to be, And then at some point it just got to where, I got, I'd say pushed out, but I got asked to make a decision for my career that wasn't going to be staying, and I took it really bad at the time. I was going through divorce and things, and I was really kind of the lowest point. I was drinking way much more than I should have, and then it was to a point where I was by myself on a 800 square feet apartment, recently divorced, with no money, no job. And I'm like, how did I get from being like the heart surgeon in the Mayo Clinic to be there, right?
Yeah.
We probably shouldn't talk about Mayo Clinic because they were very supportive and things. It wasn't like, but anyway, but then I said, well, I got to change something. So I went to Thailand. I started journaling. I started, making some room for better friends around me, removing some of the others. And then things started to get better. And thankfully, by opening up like this, because it's not, I mean, being a heart surgeon is, it's not a secret. Heart surgeons have a big ego in general. Part of the job is you have to, because there's life or death decisions and things, but it carries to overconfidence, to other things. And so, and then it was just to realize that I was, I remember where I read this, but I was also another bozo on the bus, right? So I wasn't like I was special or driving the bus. I was just trying to make it work myself into sort of a thing that was bigger than me. And so, I started to do things like that, reflect a bit more. I lost some of the weight. I trained. I took some 6 months almost to really take a pause and rethink some of those things. And the journal that I was doing every day started to be more of some reflection, and it got into eventually to be, well, maybe I should write about this. And I wrote a bit more, and then when I started to speak up about it, people came to me and said, I want to share something too, because I've had those struggles. And so that feeded into the process as well. So I think looking back, it was a lot of self-inflicted challenges, but also a lot of was brought up by the way I was trained, by the culture, by the system, so I had to reevaluate how I was functioning in the system, and how my interaction with what I called healthcare disease, because that's what I think I've had. So this maladaptive process with work led to burnout and depression and anxiety, because I did reach a point where I was drinking to sleep. I didn't really care whether my patient did well or not. So lack of caring, sort of distancing myself, was in retrospective first other signs of burnout and things like that. So it was tough, but it's realizing that it's always there, right? You have to scan yourself to always reset those values, or those things you've set up for, those objectives you set up for yourself.
Yeah. Wow, that's so powerful. And thank you so much for sharing. I think it's so powerful. And we were talking at the beginning before we jumped on the recording that how does it align, or like how does it relate? And it relates so much. Like, it doesn't matter if you're in the healthcare space or in the tech corporate world space, it's the exact same story, actually. And so it's always really helpful and powerful for me as well, and hopefully also for the listeners, to see that no matter in what field you are in, like, it always comes back down to really the simple, basic things in your life, right? Like, you talked about values, sleep, self-care, gratitude, journaling, breathing, like, it's the same. And then the schedule, I think that was really interesting, actually, that you mentioned that as well, because that's one of the things that I focus a lot on with my clients, as you can imagine, in the corporate world, like time management, schedule, like calendar management, how to set boundaries, right? How to say no. I'm sure this is something that you've probably had to learn in a way as well, because you had to say probably no to some surgeries, or you say, I'm pushing out things and cases in order to have space for myself. And so, it's very fascinating.
I said no in a big way. So when I hit, I'd say rock bottom, but there was many bottoms, but one of the lowest point is when I decided to say a big no. And it wasn't a FU, it was really a big no. I was the president of part of the National Society of Heart Transplant, and I just sent an email overnight. I mean, it was really, I thought about it for 2 weeks, 3 weeks, said, this is really painful for me to jump the meetings and do this and do that. And I just, all the boards, all the editorial boards of journals, all the responsibilities outside of taking care of patients, I just sent an email. It was like one email that I copied to many people, say, as of today, I'm sorry, but I don't think I can do this anymore.
Mm-hmm.
And you know what? Oftentimes I didn't even get an answer. Or I get a little, good for you for taking care of yourself and good luck, And it was like, okay, and
Mm-hmm.
all the anxiety that this brought me, and then finally you have peace. You're sort of like, okay, now I've created time. What do I do with it, right?
Yeah.
And so it was a big no, and then learning to say no in medicine is particularly difficult, and then no in multiple ways, right? So and I'm not saying about medicine, but it's for anybody who works in healthcare or interacts with it. It's the other case. It's the other sick patient. It's, oh, why don't you stay this weekend or extra hours,
Mm-hmm.
or a big no, and like, maybe no, this is not the life I should be living, and
Mm-hmm.
and, and I didn't really move away completely for it because I loved operating too much, but I really changed drastically my interaction with it. And I know that no, having a big academic job where I'm director of this and that is a no for me. I just, my person, although I would like sometimes to get back to doing some of those things or being on the podiums and things, I have to realize that I'm sacrificing too much of myself to be there, and I can contribute to the world or to people around me or to my patients in a much more powerful way by knowing some of those things, and knowing that it's not doing 400 cases a year. It's not writing a paper every 2 weeks or fighting for that spot on the podium
Mm-hmm.
that makes me happy or the most productive at my job for the society, if that makes sense.
Mm-hmm. Yeah, for sure. And I feel like, like even just me, like listening to your life and listening to what you've been doing, as an outsider perspective, of course, you're like, wow, this sounds so fascinating, right? You're doing all these surgeries and you're traveling and you're writing. And like, it's like everyone would probably dream of having a life like this. And I think it's so powerful to also hear the behind the scenes side of what that actually brings.
And it makes it so much harder to make those decisions, right? Because
Yeah.
I talk about this in the book too. They say, how do you walk away from, or walk a little bit away from something like this, right?
Mm-hmm.
And I'm quoting, and I don't know many people that have been doing this job for 40 years and have been on all the societies and present everywhere, that when it comes to like life achievement award or the award of their moments at the end of the presidency, the presidential address that they call, right? I don't know that many people will get up there and say, you know what? I've spent all the time I needed to be with myself, with my family, with my kids. Actually, it's the opposite. And it's some of the irony of it. They go up there and they've done all these great things for the society, for the world of the discipline. And they get up there and they put a picture at the end of their family, and they usually thank their family for being there and supporting their absences throughout the process. And
Mm-hmm.
so that's not okay, and so for me that was important. And the tragedy is that I think walking away from a job where you have you have money, right? I mean, you make good money, you have social status out of being a doctor.
Mm-hmm.
It's an infinite amount of work because it's not like you're going to chase the next job or being fired from it unless you come in your drunk or do something crazy.
Mm-hmm.
So it's job security. So sitting there and, like you said, saying, well, yeah, I'm not really happy with this job. I've studied all these years, even, and talking to your mom about it, saying, Mom, I really want to take a break from this. So, well, you studied for 25 years. So it makes it even harder to walk away
For
from
sure.
it.
100%.
So,
Yeah,
yeah.
I can totally relate. And so, what do you see common themes with your coworkers and colleagues in the healthcare space? Because I think, from your experience that you've had, you've obviously drawn a much kind of, and you've done research, or like you've collected data around how many healthcare workers are actually stressed out and experience similar things.
Yeah, there are some. I mean, there's a lot of like very thoughtful papers and through my research that I've read and talked to people, they're good friends that wrote about it. And it's a tragedy now these days. And last year, there's a paper that came out that around 50 or 60% of surgeons in training right now. So people that are actually going to do this for the next 40 years of their careers say that they would have the chance to do something that would bring them as much social status and money, they would actually leave it.
Mm.
So think about it. So you have 1 out of 2 people in training right now in surgery that would want to do something else.
Mm.
It's crazy because you're devoting
That's
100
crazy.
hours a week to do this.
Yeah.
And they did a survey on heart and general surgeons, heart surgeons, and surgeons in thoracic and cardiac surgery. And they just sent out a questionnaire and asked them if they had some of these symptoms that were mostly symptoms of burnout and depression, or mild, some various degrees of it. And
Mm.
about 50% of people had some degree of burnout and depression.
Mm.
And so then you have 50% of people that want to do something else, and a good 50% of them and more also have mild to moderate depression. That's a pretty big deal for people who take care of other people, you know,
Yeah. Yeah, for sure.
or to devote the next 40 years of their life to it. And so I guess the common themes are that we are still haven't really gone away from the cultural training that we've had. So there's still a culture in medicine of giving your life to it, or committing 100%. And I'm not saying like the care, I mean, just giving yourself to be there for every little aspect of it and forgiving yourself. And so I think that comes
Mm.
from, it's in heart surgery even more, I think, than other specialties, but from our pioneers and people that have developed this practice in the 50s or 40s or 50s. That's all they did, right? They call it the resident because that they slept in the hospital, you know,
Mhm.
and they were living in the hospital, and so physically. So I remember one of my mentors saying he trained in some of the big programs in Texas, and in the days of people being pioneers for this, and they had 2 hours to go home on Sundays
Oh.
to go, see their wife and kids, and they had to come back and sleep in the hospital. So I think we're not there now because there's a lot of rules around hours and things, but I think we're still poised with a certain amount of history in medicine.
Mhm.
And medicine in general is pretty slow to adapt. I think the industry, you talk about the industry, the techs and things, I think they've found a way to, especially during the pandemic, transition to like home hybrid work and that kind of stuff.
Mhm.
And I just reading a Harvard Business Review article recently where it just explained that a lot of these tech companies and see it won't get back to at work things. And medicine for a lot of things doesn't need to be face to face. I don't need to see an 83-year-old grandma face to face as she drives 2.5 hours to look at the CT scan with her and tell her you need that valve put into the groin and that's it. Right. I can see her on Zoom. I can flip the scan, and then she doesn't have to drive the 2.5 hours with her,
Ah.
with her relative and things with the snow. And so, and still, with the pandemic, it has forced a little bit of that on us, but we're very slow into some adapting those things that ultimately bring, I think, wellness at work, decreases turnover, happiness at work, and just to have the ability of some hybrid work like this. And there's still common themes, I think, in the practice that we're reacting to acute settings, right? So person drinks at work, person is depressed, gets angry, is anxious about something and loses it on the word, then we have HR for it. They just say, okay, you have to go to, charm school, and take a break, administrative break they call, and then they check a box and you come back, you do the exact same thing, and then another time. So I think there's a lot of reaction to systems, and I think it would be much better for systems to be proactive on wellness. And we did some little things, and that's what we're proposing with some of our programs that we're trying to build on, is to go to these places and say, listen, maybe a Friday jeans would be helpful, or maybe an hour so that they finish earlier on a rotation. They can get their kids at the daycare a bit earlier. So little things, maybe it's the geographic orientation of desks even. I mean, it's little things that you feel will make people happier at work,
Mm-hmm.
and could change things. So a lot of history that I think we're facing in healthcare in general. And it's still a lot. I mean, I get a lot of like messages and emails and phone calls about being, let's say, honest about what I lived through as someone that's regarded as I guess in heart surgery, someone strong, right? You can't talk about your emotions. This is a big deal, right? You're a heart surgeon, you make the decisions. But I think breaking that mold is to listen, it's okay not to be okay. Doctors cry too. And, it's fine after a week that you lost 2 patients to reach out for help,
Mm-hmm. Mm-hmm.
being more proactive about these things and creating more of a movement to say, well, we need to think about this in the long term here, not just because HR check the box.
Yeah, 100%. And again, it's like that's super parallel to what I'm thinking about in terms of like being more proactive instead of reactive, right? Like to have, in the corporate world, to have like, EAP programs, like employee assistance programs and healthcare in place. It's great, right? But why are we waiting until people burn out in the first place? And why are we not teaching them how to not get there? And so that's my next question for you, because as a healthcare worker, right? Would you say people are usually pretty aware of mental health, but they know what it is and they know how to not get there, but then they still do it? Or do you think there's also a lot of education required in order for people to better understand what kind of effects that actually has on us as people?
Yeah, I think I think it's still, people have a concept of it. I think now with the publicity that it has had, I think people are a bit more in tune with it. But, people see the big things, right? You get a maniaco-depressive episode, right? You wake up at 4 a.m. making food and writing papers, sending out emails, and the next day you're crying because you have too much, so that kind of stuff raises attention, right? Mm-hmm. But still, I think things like lack of empathy or even just being angry. Being angry is actually not normal, and I've learned that it's like your body trying to express emotions, right? That you can't control, and so. The awareness of that, like, or being rigid or being, very, very centered of your own self. I think that level of depression, of anxiety, of mental illness is not still there in terms of awareness. Mm-hmm. The people see the big things. People come drunk at work. He's anxious, can't come to work, can't drive, can't get up in the morning. That's pretty obvious. But and then I would say, and I'm sure you've seen some of those things on the news and things. Unfortunately, workers, committing suicide or, people quitting their jobs because of the pandemic. Pandemic really has just amplified a lot of the background stuff. It's like you're driving with a really bad car, and then all of a sudden it starts to rain and then snow and things, and so then you can't really drive straight anymore, and then the car doesn't work or start because the car's shitty to start with, right? Mm-hmm. And so if the system had underlying issues in the pandemic, has just raised this to a different level. People were already stretched and burned out and not well paid, and sort of, and now it's just a different level. And while you see, and I'm trying to actually have a meeting in a couple of weeks to pitch something bigger to a pretty large pharmaceutical company, but I think now while you're hearing a lot of that stuff, people being burned out, people having issues with work turnover, and we I think in Quebec now, I know Quebec numbers because I was just there. They're missing 6,000 nurses or healthcare workers in the system. I mean, really? Like, this is, and so instead of like being proactive, and they just have these sensationalism sort of stories. So this one just committed suicide, big deal. Let's do like a little, but what do we do about it next, right? So there's, in the corporate world, it's probably more common, but you do have papers and data around having a therapist that's assigned to let's say a broker's firm or whatever, that decreases turnover, improves productivity, and even finances at the end of the year. Healthcare is to that point now. We need to realize that it's just as important to have the new technology to provide the best resources for our patients than to have happy and healthy workers. And so because turnover is not good for quality, turnover is not good for patient care, and that's not even like mental health. I mean, you step it to a different level. And so I think we're at the point of creating a hashtag healthcare anonymous, whatever, and say we need to create a program or a movement that comes in. If you buy that valve, you get this program, and then we assess your work environment to make it better, and make resources available more on a prospective basis, as opposed to more a punitive type thing, right?
Yeah.
You've been angry, so
exactly.
time school.
Yeah, for sure. And is that basically your vision on what you're trying to work on?
Yeah, I mean, the book is just a small piece of and it didn't come to I mean, it's not about Simon, right? It's about using Simon for the greater purpose. And the vision for me is healthcare is just a small piece of a bigger problem, right? In high performing environment, like you said, being an athlete at high levels, and we're certainly hearing some of these mental health issues now. Being a CEO at a high level or being a healthcare worker, it's just the same topics. And so I'm trying to create, and we've associated ourselves with some data and some companies that have very cool devices to monitor some of the sleep and the things and analyze or propose with AI some of the videos or things you should make better on an iPhone and things. I do feel like the vision is to really get or use the interaction with industry to really get into hospitals to really understand the need for this to get better. And because ultimately they also are suffering from this, right?
Of course, yeah.
And it's measurable, it's money. And so of course, one person, but it has to be a movement. I mean, for people to get on board, we do have to have, not at the same level as, like what we saw with the racism in the last 2 years, or some of this other things, with what Black Lives Matters and things different. But this is a real threat for society. I mean, having that much pressure on healthcare workers, and to think that it's going to go away by just the pandemic going away, or throwing more money into it, or changing systems to be more of a hybrid way, or paying more. So it's not going to go away. It's just going to keep coming there. And it's a real threat for society, I think.
Yeah, for sure. What is your book called?
So it's called Healthcare Anonymous. It will be translated in French as well, as the French rights got bought like a couple months ago, and it'll be called Code Blue. So, that'll be interesting. But in the US on Amazon, right, it's called Healthcare Anonymous. And it has no parallel with Alcoholic Anonymous, which I had to read at some point in my life. But it is a bit of the same concept to say, you always think that the sick person that drinks alcohol is the one that is drinking is drinking out of a plastic bag, like a brown paper bag thing on the street and things, but the majority of them are not. And so it does present some of these shades of gray, for lack of a better word, in the book, with like self-testimonies of people that have been through these kind of variations, whether it's drinking and being very functional, whether it's the mother who has 2 kids, when they go to school, she opens a bottle of wine. So this has about 20 stories of people that represent these different variations of clinical manifestation of the disease, because I call it healthcare disease, right? And say And then the burnout, it's a shift in culture, right? The burnout is not the problem. The burnout is the end result of, it's not of people that have been in that system. And I present this as a disease for many years living through it. So we have nurses, we have doctors, we have technicians, we have patients that talk in the book about their experience, even for patients with, sick workers, of people they've noticed to be sick.
Yeah.
So I think that's really, that's the bulk of the book, but it does represent the power of people that, I couldn't write the book without the stories. It was just my own story, so it's sort of boring, but having everybody come up, and my role was to really kind of gather these people and then have it come organized so that the disease presents itself in 4 different types of clinical manifestation, but it is a representation of a maladaptive process between, I call it, the host, the agent, and the environment. So like any disease, right? So it's either the milieu, it's either the person that's into it, or the relationship with the agent that causes the problem. And so that's what we're trying to make in the book.
Mm-hmm. So cool. I am so glad in a way that you've had this experience because, now here you are being able to help so many other people with this. So thank you so much for that work and for sharing your story today on the podcast. I think it will help a lot of people. It's super fascinating. I'm really curious to read your book as well. And is there anything else that we have not said or that you would like to share before we end the podcast today?
No, the easiest way to order the book is, of course, Amazon, but you can go on it's called, I think the website for it's called healthcareanonymous.com. So you can even get samples of the book as well before it gets published in April. And it comes also with, we also have different packages where I can come and give a talk about the book or the process, even evaluate the environment where people work in, and give them some of my wisdom, I guess.
Perfect.
I'm just excited to be, whatever journey that gets me into, that will be something. And the hope would be that we see as much hashtag Healthcare Anonymous than hashtag Black Lives Matter, because I think it's comparable, but I think the point of creating a movement around it is, we're at a tipping point where we need to take this seriously, or they will affect our lives as patients, because I'll be sick at some point and I'll need some guy helping me out, or some woman helping me out. Mm-hmm. That is not, caught up into the system,
mm-hmm. Yeah. Cool. Okay. So Healthcare Anonymous, hashtag Healthcare Anonymous. And the book is coming out in April. What specific date in April?
April 5th, I believe, is the release date. Yeah.
Awesome. Cool. Yeah. Well, thank you so much for your wonderful, spirit. And I wish you all the best in your journey.
Thank you, Julia. Appreciate it. Thank you so much.